Thank you all so much for joining us today. My name is Princess, and we're here to discuss the hidden dangers of the nail salon. I'm here with a special guest, Dr. Meislos, foot and ankle specialist here at Memorial Hermann. Dr. Meislos, thank you so much for joining us today.
Thank you for having me.
So we're really excited about this topic. I know for most people out there, the nail salon is definitely my getaway place. At the end of a long week, I like to go get a nice pedicure, a nice manicure. But, I'm a little shocked to learn that there actually are some dangers that we actually need to kind of consider at the nail salon. So we'll kind of just get into it. So for all of you watching at home, feel free to leave your comments inside our comment box and we'll be able to answer your questions live. So Dr. Meislos, let's dig into this now. So can you explain a few nail salon red flags or basically things we should kind of look out for?
Well, there's a lot of things you need to look out for. First is you want to go in, you want to make sure it's a clean place because if it's dirty inside, chances are they're not following proper sterile technique. You want to make sure that the instruments are autoclaved.
Okay.
You want to see them open an autoclave bag. You want to see that your technician's wearing gloves.
Okay.
So also, it's a good idea, go to the bathroom, see what it looks like. If the bathroom's dirty, chances are they're not doing a good job keeping it up to standard and clean. And there's other issues too, such as, you want to check to see if they're using a piped basin versus, a pipe-free one. So a lot of red flags, but, those are the big ones to look for.
Wow, okay. I already have a lot of questions based on what you just said. All right, so to kind of go into that a little slower.
Okay.
So you use the word autoclave. So what's the difference between autoclave and a sterilizer? I know most of the times, if they just like clean down the little, foot soak, that should be enough, right?
So when you go, like old school barber and you see that they have that jar filled with that blue liquid,
little juice.
That's bad.
Oh.
That does not disinfect.
Oh, wow.
An autoclave is steam pressure. And so first you need to make sure you clean the instruments and then you're applying steam pressure real hot and that can kill any bacteria, any virus, any pathogen. And that's where you know it's being done properly.
Okay.
There's all kinds of other ones, such as ultraviolet, dry, electric. None of those kill all the bacteria. So the only one you can feel really secure about is the autoclave.
Okay, so that's the one that's definitely important.
For sure.
So now I'm just thinking in the mind of my relaxation day. I go in, so based on what you just told me,
Right.
I go in my mind, I start to survey this nail salon.
Okay.
I go to the bathroom and it's clean. They pull out the sterilized, materials. What about all of those smells in the nail salon? Like sometimes I actually get dizzy, with the things to soak my fingers and my
Right.
toes and what they're using to clean. Like, should I be concerned about all of the stuff I'm inhaling during my appointment?
That's a good point. You should. So usually what you smell is like the acetone,
Yeah.
which is used to, as you know, to remove the nail polish. And so you need to make sure there's proper ventilation because
Okay.
if there's not proper ventilation, there's all kinds of problems that can result from that kind of exposure, from breathing problems to asthma to even developing cancer.
Wow.
So you really want to check and see if there's proper ventilation. But more importantly, you just don't want to be overwhelmed by a smell.
Okay.
So
So most salons should have a proper ventilation system kind of working, not just the
if
door
they're
open.
up to code.
Okay.
Yeah, if it's door open, or if you see a fan, just I would run. I wouldn't even, I would go to the next salon. So
Okay. So another question would be, so what's the difference between like the typical sterilizer and the autoclave?
right. So the typical sterilizer. A lot of places, they'll walk the walk, okay, in the sense that they'll have like the pouch that you would use
Okay.
in an autoclave, which is the steam pressured one, but they don't actually have the unit. So don't be fooled, by just looking for the bag and them opening the bag.
Okay.
So
that shouldn't be.
that's a rookie move. Right?
Okay. Rookie mistake.
Beyond looking at the bathroom like we were talking about before, I would look for the actual autoclave unit.
Okay.
Another trick is with the autoclave bag, there's a change, right? There's a change like in color that will tell you once it's done. Like it'll cause it to go from black or from white to black.
Okay.
And so you'll see a black line. So you'll know that they didn't just have the unit, didn't use the unit, and just open the bag. They actually went through the whole cleaning process. As far as like the other ones, there's like I mentioned the barbicide kind of one, right? That blue nasty liquid.
Yeah.
Then there's the ultraviolet ones, and then there's an electric one. But really, you need to see the unit. You need to see the autoclave steam unit.
Okay, so basically I can't judge a book by its cover. I actually need to open this book and read it
Yeah.
to ensure.
I'm not saying you need to go to Nail Salon 101 and you need to get a PhD in this, but real quick, just go in, let me see your autoclave unit. I think it's a reasonable request. okay? And then look at the bag when they open it, look for that line. You see those two things, you're good to go.
Okay, so I can imagine that just like, you know, my nail salon tech, that you've also seen a lot of feet in your practice.
That's what I do.
So, can you really pick up infections or like nail fungus at a salon?
Yes, I see it all the time. I mean, it's not just you get infections in the sense you can get ingrown toenails, you get nail fungus, you get trauma to the nail where the nail falls off. There's all kinds of infections that can be developed, you know, in a nail salon because, you know, they're not sterilizing these foot baths, these whirlpool baths. And I mean, they've done studies. There's hepatitis C, MRSA, everything that you could be possibly scared of getting.
Oh my goodness.
You can acquire there. But I get every day people that come in saying, my nails didn't look like this before. I went to the nail salon. Now I have an infection. Now it's yellow. You know, it's harder to treat. You know, but if you do the work on the front end of it and really make sure that the place is up to code, then you're better off.
So is that commonly seen, like, so say I have like maybe a hangnail or something and I, you know, removed it myself at home and then went to the nail salon. Is that really like how I would pick up an infection from an open wound or? Well,
first of all, you shouldn't treat a hangnail on your own.
On my own, okay.
So
something to note.
That's the first mistake, right? So you're at fault for that one. Yes. Ingrown toenail is, you can't really treat an ingrown toenail effectively unless you're using anesthesia. That should not be done in a nail salon. I've actually seen patients that have come in to my office that have developed traumatic gangrene, had an amputation of a toe because they went to salon and they tried to do an ingrown toenail procedure. There's all kinds of risk, like even with those instruments, they shouldn't use any sharp instruments.
Oh, really?
Like if you go to the nail salon and, you know, you have calluses and they say, oh, and they take a cheese grater, like a device with a blade on it.
Yeah, I always see that little nice little tool there.
That's illegal.
Oh,
okay, they pass codes in Texas that is illegal. The reason is because, you know, they're not prepared to use it. It's like a surgical instrument. They could cut the skin. And once you have an opening, it's like just an opening for any kind of infection. And nail salons, it's just like just bacteria, fungus everywhere.
Wow.
So really, I mean, that's why they tell you if you're going to get a waxing or if you're going to shave your hair, make sure you know, wait 2 days before you go to the nail salon so that any wound you might have developed might heal. The same thing goes with the cuticles, right? So that's always a big thing. They push the cuticles back, but the cuticles are a barrier basically. And so what you don't see is they make a little cut, a little nick, and then next thing you know, that's, you know, the possibility of getting an infection. Wow,
so these are a lot of things to kind of digest.
Right.
I want to kind of go back to my pedicure.
Okay.
So usually I see they put something that looks kind of like a shower cap. You know, like a plastic covering, you know, over the basin before I soak. So I'm always like, all right, please put the shower cap in this basin so I can soak my feet.
Right.
At that point, am I safe or do I need to consider a few other things there as well?
There's still plenty more. So the first thing you want to do, I'll tell you what I consider to be the highest level of standard, which really at this point there's still more room for improvement, but basin, right? You don't want it to be piped because the pipes, whether there's a filter, they're not being cleaned, it's going to harbor all the bacteria. And like I mentioned, there's numerous studies where they've grown all kinds of different pathogens, bacteria, virus, hepatitis C, you name it. So you want to have the disposable liner. That's what you're referring to, the shower cap. Okay. Sometimes they do look like a shower cap. That's not aesthetically pleasing, but so you want a basin, right? So no pipes. That means they're filling the water in with the disposable liner, and you know that you've got this perfect seal, right? So at that point, they empty it, they remove it. There's no risk of contamination. So that's the first step. So I mean, in my practice, you know, I'm going to be opening actually adjacent to my practice like a medical spa. We're going to be doing medical manicures and pedicures, and so we're going to take it, but to the next level, where we're also going to have like a UV light sterilization that you see like in the OR. But so that's part of, you know, the process of what you want to do. Well, you just said a word that, you know, I think a lot of us are familiar with, UV light. Right. So let's move on up to my manicure. Now it's time for my mani. I finished my pedicure. You know, I'm like, you know what? I want shellac. And that's like one thing that I think most of us really enjoy because it lasts longer. Is it true that UV lighting or even getting like a shellac can actually cause cancer? So yeah, it's not the shellac, it's the UV light, right? So it's like a tanning bed, same risk. It's skin cancer. So they actually have LED lights that do the same thing and there's no risk. So yeah, avoid UV lights, or you
Wow.
can just let it dry. It will take longer, but the best thing to do is use an LED light.
So the LED light is the alternative to
Correct.
that. So is it essentially the same thing? Can you go into a little more detail about that for those who don't really know?
I mean, I'm not an expert on LED lights, so I
Okay.
really don't want to elaborate more
Right.
on that.
No.
But I can tell you that it's going to be the most effective way without having the risk of the UV light causing skin cancer.
Okay. Does getting your cuticles cut at the nail salon, you kind of already mentioned
Right.
this, put you at risk for infection because of the open wounds? Or is it that they actually shouldn't be doing this at the salon? Like what actually...
It's the open wounds.
Okay.
Yeah, it's just basically the cut that's done into the cuticle. And it's not always. I mean, not everyone's gonna. But if they're not real gentle, if they're using a sharp instrument, they can easily make a nick into the cuticle. And then, you know, it depends if they're soaking it in a basin that has been properly cleaned. You would be surprised. I mean, if you go and you really look at these salons and with a close eye, and even ones, I'm not going to mention names, that I've been to that tout themselves as being like the highest end, they're far from where they need to be.
So would you say that it would be smart to kind of bring my own tools to my next appointment?
That's a good point. So my preference, okay, is to not bring your own tools, because if you have an infection and you're reusing your tools, you know, they're not being cleaned.
Right.
And so I get patients say, oh, well, I bring my own tools and I wipe them with alcohol. Well, I mean, if alcohol cured everything, you wouldn't need to go to the doctor, you know? You wouldn't need all these treatments for nail fungus. It just doesn't do it. So the best thing you can do is go to a place, get your own instruments, have them autoclaved.
Okay.
Okay? And then, but if you can't do that, or if you're not willing to go to that, the second best thing would be to bring your own instruments.
Okay. So kind of piggybacking off what you said about the infections. So how would I even know that I have a nail infection? I know sometimes it won't be till after, maybe weeks after, maybe, you know, your finger's warm to the touch, or
Right.
how would I know that I have a nail infection?
So obviously there's the appearance of it, right?
Okay.
So fungus, it's not going to be an overnight thing, right? You're not going to go in and then the next day your fingernail and toenails thick and yellow, looks like petrified wood. It's going to take time to develop,
Okay.
but that's just the fungal component of it, right?
Wow.
But the ingrown toenail, that part can develop fairly quickly, and you'll see the surrounding skin become red, become inflamed,
Okay.
pain. If you have pain, that's not a good sign.
not a
You
good
shouldn't.
sign.
This is not. You know, it's just like getting a massage. You should feel better after. You know,
Right.
you shouldn't feel worse after you get a manicure or pedicure.
Okay.
So if you just see any of those signs, or pus, or obvious signs like that, then you know you need to go to your podiatrist or go to your dermatologist for treatment.
So how are these nail infections treated?
So if it's an ingrown toenail,
Mm-hmm.
so if it's really bad and really infected, you can be given an oral antibiotic. But in addition, you have what's called a partial nail avulsion matrixectomy. It's a fancy word for numbing up the toe,
Okay.
okay, and just taking the offending portion of the nail, and then you can choose to have it permanently removed if this is something that reoccurs often, or you can just have it removed without having it killed the side of it so it doesn't regrow.
Okay. So what can fingernails pretty much tell you as a podiatrist?
So, I mean, your nails can tell you quite a bit about your health, right? So if they're yellow, if they're thickened, we talked about that. They can be a fungal infection. The word for that's onychomycosis.
Okay.
There's possibility of developing melanoma. You know,
Wow.
it's a skin cancer. So if you see what's called like a Hutchinson sign, if you see like a linear streak, that these are things that you can develop. There's psoriasis can manifest in the nails, and so you can get psoriatic nails. There's things you can see that can indicate that you might have problems with your thyroid, with your liver, congestive heart failure. Everything from the pitted nails for the weak nails, for the if their nails predominantly all white. There's literally it can appear in many different ways,
Right.
and so if there's any kind of change, you need to be worked up, basically.
Okay. So, like, if I were to have a nail infection, could these kind of things be spread, like, if I go to a hot tub or a swimming pool or the sauna?
If you could spread it to someone, is that what you're asking me?
Yeah.
Yeah, I mean, in theory,
Okay.
it's not like it's airborne. You know,
Okay.
it's not like
Yeah, but I
you
mean, if
have
I'm
to all of a
floating
sudden-
around in a hot tub...
I mean,
and-
I get patients all the time, and that are really worried because they have fungus and they have OCD, and they'll
Yeah.
scrub the whole house and scrub everything, and they're like living like in a bubble. And I'm like, you don't have to take it that far, but it's more if it depends on your immune system, right? Are
Okay.
you susceptible to the infections? And then it depends if it's direct introduction, right? If you get a contaminated instrument and it's shoved into your nail bed, and then that's you're gonna get an infection, right? But if you're diabetic, or you have compromised immune status, and you're around these pathogens or the bacteria or the fungus, you're susceptible to infection.
Wow. So are some of the tools at the nail salon only like single-use items? Are there some that they shouldn't keep reusing over and over again?
Right. So I would say like an emery board.
Okay.
Disposable.
Okay.
Pumice stone, disposable. Buffer, disposable. If you see that they're bringing something and they're dusting it off, and you're seeing a cloud of debris, run. Get out of there.
Run right out of that place
Yes.
as quick as possible. So I guess for everyone watching out there, what are, I guess you would say, 4 signs that we definitely need to look out for when we go to the nail salon?
So biggest thing is going to be the autoclave.
Okay.
Right? That's actually like the law now. So they are required to have an autoclave. That's the first thing.
Okay.
Second, gloves. Right?
Okay.
You wouldn't want someone treating you without gloves.
Right.
Third thing is the smell. Right?
Okay.
Is there proper ventilation? And the fourth thing is just making sure that we didn't talk about this, but it's the risk of contamination, that they're using the same bottle over and over again.
Okay.
So I recommend, in addition to that, that you either bring your own bottle, or you can get a disposable brush. It's a single use.
Oh, wow.
So,
I never even considered that.
well, that's not something that people are currently doing, but
Okay.
that is something that I will be doing at my salon.
Well, that's
or
amazing.
my spa, I shouldn't say salon.
Well, that's definitely something that, I might
Yeah.
have to come and visit you on my next nail appointment. Dr. Mysos, this was
Sounds
like
great.
such an important and great conversation with
Okay.
you. I have so much now to like keep in mind on my next nail appointment. Thank you so much for joining us today. I'm sure a lot of people have learned a lot of things. For all of you watching at home, you can definitely click the link in our bio where we have more information on this topic. Thank you all so much for joining us. Thank you
Thank
so
you
much
for having
again,
me.
Dr.
I appreciate
Mysos.
it.